Dr. Shane Hopkins, and this is the Trinity Cancer Center, and we are just getting a new linear accelerator called the TrueBeam. So I wanted to show you through the department and show you how it is. Our nursing station, we have a clinic that's very much like other clinics you may have been to, physician exam rooms that have an exam table and all the normal instruments to get to know a patient with a history and physical. We'll do our nursing assessment and make sure that we understand the medical situation that requires radiation. So the CT simulator is where we capture a patient's anatomy into the computer. Having a 3D model of their body helps us to determine exactly what angle the light will come into their body so that we can be sure that hit the cancer and avoid the organs at risk that would be sensitive to the radiation and could be damaged. Alright, so we've reached the linear accelerator vault. This is the control room where the therapists are able to operate the linear accelerator. This is the multi-million-dollar piece of equipment that creates the mega voltage X-rays that will go through the patient to kill the cancer cells. The vault is the room that requires a lot of money to construct because the walls are 4 feet thick concrete. And there's an entranceway that's called a maze, which is just a corner that wraps around so that there's no direction that the high energy light can go in the room and escape out to the general population. We want to make sure that it stays in the room so that we aren't radiating people that are not needing it. So this is a very heavy door that will close the vault, and it is the thinnest part that's sheltering the room. It's got a specialized compound that prevents the leakage of neutrons. Neutrons are created in the process of radiating patients, and they're not the therapeutic kind of radiation, they're kind of a byproduct, and they can be dangerous. And so this is a fancy kind of door that prevents that leakage out of the room. And this is our new linear accelerator called the TrueBeam. It is the latest and greatest. It's a fancy machine that will accelerate a pencil beam of electrons through the waveguide in the head of the machine. That goes so very fast as it slams into a tungsten target, it creates a spray of photons. So that radiation is mega voltage X-rays, the same kind that's used for radiology, but we don't use it to take pictures, we use it to treat cancer. And it's about 1,000 times more powerful than what they would use for a CT scan or for a chest X-ray. So as that is directed down toward the patient, we can shape the beam with the aperture, the opening in the head of the machine, and the table can tilt and accommodate a patient to make sure that they're in the correct position so we can make it extremely precise. This is an immobilization device we use for our head and neck patients. You may notice when you look at it, it's shoulders and head, and this is allowing us to keep someone's neck immobilized when they're being treated to the lymph nodes going down each side of the neck. The head of the machine, this is where the high energy radiation comes out of. But we also have an onboard imager because on a daily basis we'll take X-rays or a cone beam CT scan to verify the positioning of the patient to make sure that they are getting the radiation to the right part of the body. So one of the nice things about this linear accelerator is it has the capability to do a very intense dose of radiation all at once. So where we were previously treating lung cancers, and we still treat some kinds of lung cancer in 6 to 7 weeks of radiation, now we're able to do it in just 5 treatments, sometimes on consecutive weekdays, sometimes every other day to give them a little break between each treatment. And so that makes it very, very quick in comparison, and that's a lot easier on patients. It's comparable to surgery in terms of the outcome. So it is a curative treatment for example, stage 1 lung cancer that we didn't have available at this institution before. We also treat breast cancer, prostate cancer. Those are probably the 3 most common combined with the lung cancer. And then we treat a variety of other GI cancers, metastatic cancers, brain cancer, bone pain. We can help treat to stop bleeding and other things. This particular machine is useful to try to do curative treatments in a lower number of treatments, and that's new to our institution.